the recovery from ACL surgery is probably one of the biggest concerns. People want to know, what are you going to do, or what should I do? And they're a bit overwhelmed with that because it's out of their comfort zone to really choose the technique or the graft. And it's really beyond their knowledge, so you have to kind of educate them and bring them along. But the recovery, they own that, and they know, hey, okay, this is my pain, this is my rehab. What am I getting into, really? What are you going to do to me? And so it's one of the biggest parts of that preoperative counseling session with a patient is to have them fully understand the early and mid-phase recovery after ACL surgery. I like to break it down like that into stages. I tell patients it's kind of like building a house. Maybe if you're an athlete, you kind of consider that your house got blown down, It's a bad thing, There's a little bit of a grieving process here, that they're going through. And then you got to explain to them that we're going to rebuild this house, your knee stability, your thigh strength, your athleticism, in an orderly way, in a set of stages, and you can't put the roof on before you frame it. So there's an order here that you go through, and we just try to walk them through the different milestones of recovery. What are you going to get into right the day of surgery? What are we going to let you do? Are we going to let you put your weight on it? Are you going to have crutches, brace, drain? When do we transition out of that? When are we going to be walking normally? When am I going to feel fine and not think about it? That's another milestone. When am I going to be able to jog, ride a bike, road cycle, hill program on a Peloton, or some kind of exercise bike? When am I going to sprint? When are you going to let me jump, cut, land? It kind of goes in that order. And I think something that parents fail to realize is that there's a difference between completing therapy and basically being okay versus restoring athleticism. And that's a totally different thing. That you transition out of therapy where they don't have a lot of weight equipment into the gym, good weight program, maybe a sports performance program, a dynamic functional program with a lot of athletic movement. Most guys that take care of a lot of athletes would tell you that it takes about 6 full weeks of completely blowing and going full speed cutting and athletic movement before a player really feels like they're themselves again and before it's safe to let them play. I think some of it's mental, some of it's physical. But if you let them go back prematurely when they're kind of one-legged, which they can do, particularly a good athlete, they can go back and be fairly dominant off of their other leg. I think if you let them do that, that increases the risk of injury to their other leg. Maybe that's one reason that that overall nationally the risk of injury to the other knee is higher. Maybe we're not really topping off the rehab. But it's a huge issue. It's a really important issue. There's some economics of it. One of the things with recovery that I see in the community is that sometimes there are cost restraints, whether it's a managed care program, there are limited number of therapy visits. And I think a healthy way for a parent to look at that is just think about, what would my kids' travel team cost me next season for volleyball or soccer or lacrosse or whatever it is? And it isn't cheap. And you should just take that budget and commit it to their rehab. High-level sports performance, get the people, pay the people to spend time with your kid and rehab them, or with you and rehab it. And I think that severe restriction on physical therapy, or it's almost a rationing of it, is really commonplace, and it absolutely affects outcomes when you talk about athleticism. So what I would say is, just like you devote the resources to the kid excelling in their sport when they're healthy, devote the resources to get them back where they can excel when they come back.